Code blue, G is in golf, 8127. Code blue, G is in golf, 8127. Code blue, G is in golf, 8127.
What are you guys doing here?
What are you doing here?
Me, it's
my patient,
turn.
my patient, my code.
Yo,
I'm
we
the
talked
code
about
patient.
this.
I'm the bonded guy over here.
Yeah, but since when do you bother to leave the ICU?
I'm the code Guys, patient.
Why so many people here? Who is
I
writing
know the
code?
patient best.
We're
Who
sorting
is
this
it?
out.
Matter, it's a code. Code
patient
trumps all.
It wasn't my patient. I was lying, but I wanted this code.
Guys,
It's my
Bonded guy
turn.
here.
We all agreed I'd have to do the next
guys,
one.
who is writing the code? Nobody's doing chest compressions. Who is doing anything here?
Alright, fine.
I'll get there. Here.
Did you ever go to this ACLS training?
What's the
this?
problem now, Mary?
Well, you're compressing the stomach.
Yeah, but it's fine.
I don't know what the hell's going on over here. I'm the concrete guy. I'm the best dressed man over here. I'm supposed to be running the code.
Fine, just continue whatever you're doing.
All right, guys. Tube is in.
Alright,
Airway secured.
1 second, pad is on.
Alright,
Check for rhythm.
epinephrine's in. I don't know what the hell Mary's doing. She actually knows nothing. And she's asking me to give them medications. Are you freaking kidding me? Is that what I'm supposed to do? I'm going for pound grid here.
Check.
Alright, rhythm's good. VFib, clear.
Are we ready to shock? Are we ready to shock?
What is going on?
What is going on?
He's
with
alive.
you?
He's alive. Oh! Yes, guys.
Awesome! Great work again, guys.
I knew we could do it.
You got it.
Awesome,
You just
perfect.
saved your life.
Oh, man.
of a nap.
Guys, what are you guys doing in here?
We just saved it.
The code is in the next room.
Oh.
Come on, let's go.
Oh no.
Oh no.
It's my code!
I get this one.
I think we did a good job.
Patient's heart rate is 78, blood pressure is 120, thanks. I wasn't really sure what I was supposed to do with that. Yeah. Alright, actually, did you call them?
About to.
Okay, this is not scheduled, right? There are a lot of smells in the hospital that are bothering me today. So I'm trying to protect myself a little.
Inclusion that it was because of arterial occlusion, yeah. So it could be because of embolic causes, it could be because of thrombotic causes.
I love Tucker. This is my 9th month of it.
It's interesting because
Will you see that on this? No.
Probably not, right? Because this is just a CT abdomen and chest, but you didn't actually get a CTA or an MRA.
We were, he was supposed to get a mesenteric angiogram yesterday, but they couldn't accommodate him, so he's probably gonna have to do that as a follow-up. Okay, so, considering the
Hello. Well, obviously it's everyone's favorite rotation. Myself included. He doesn't need their help with it though. Okay. Thank you so much, Ian. Okay. Okay.
what other causes.
So this is a 47-year-old. She came in last night from the ED for new onset hematemesis. She has a history of alcoholic cirrhosis, bipolar hypertension. She's been banded a couple times, most recently in January 2017. She's also status post-tips about 6 months ago.
So if I was asked how I like to do rounds, I mean, the traditional thing is you have to stand outside the patient's room to discuss the patient.
And I guess she was kind of doing well, and then the last couple of days, she's been sort of progressively a little bit confused.
You know, there's sort of a time pressure, obviously, to try to get as much done as you can. The last evaluation of the tips was?
I think 2 months ago.
And the tips was
padded.
Okay. So, when we talk about a TIPS, we talk about a couple different things in terms of whether it's patent or not.
Holy crap.
So, we look at the velocity, which is the example I always give is the Niagara Falls example.
I mean, as soon as I said tips, that my heart I think skipped a beat. So I was like, oh my god, here we go, the Niagara Falls story again. The reverse flow, whatever, the backwards flow. I mean, how can that guy talk about tips for so long?
What you see at the mouth of the Niagara River is it's a very placid, very broad expanse, but as you get down towards the falls, it's very turbulent, as if
Yes, sir. Yeah. Is the first patient over? Denies any drug use. Says the only drinks alcohol occasionally. Yeah.
You know, these guys complain all the time about how tough it is and how long rounding takes. Really, we get to bond, you know, we share some graham crackers.
annoyed, guilty, eye-opener. But really, it's not a very adequate way to ask people about alcohol exposure, because what's social for some people is abusive for others.
It's not that bad, we learn about tips.
Approach. So the audit questionnaire is a 10-item questionnaire that is being pushed now as a...
What day is it again?
So, you know, saying that you drink socially is kind of like, you know, we need to pin him down a little bit about exactly what does this mean.
The other thing I don't get, how does this guy around for so long? I mean, what, does he pee? Does he eat? This guy around with the Foley or what?
Dr. O'Shea, it's 11:30. I think we have a noon conference, so...
I try not to stop for lunch because, to be honest, eating is a sign of weakness. Okay, well, I'll see you when you get back.
Okay.
All right.
Okay, I think we have some mental status awake. Vitals. Her reads like 46. Sinus. Blood pressure 98. 62. I just like logged into the computer and he like locked all my notes at like 6:30. Lungs. He doesn't even ask about lungs.
Hey, I got a couple more things for you, okay?
Okay. Yeah, just put them in my inbox. Yeah. More potassium. Great.
Hello, my name is Dr. Khader. I'm the rheumatologist. How are you doing? What brings you in today?
I have pain everywhere. Like, this hurts. This hurts. My knees hurt. My feet hurt. I can't sleep at night. Was that guy a nurse or a med student? Aren't doctors supposed to wear white coats? Like, I'm having trouble going to the bathroom. I wake up in the middle of the night and I can't breathe. And my head hurts all the time. And I just don't know what to do. And it's just like, I don't even know how to deal with this anymore. And it's so difficult to get in touch with you guys to get medicines. And it's just like, no one has an answer for me, ever.
So, I think you have one of three things. It's either lupus, or it's a more complicated thing called rheumatologic lupus syndrome. Or it could be, since none of what you told me fits with lupus, you could also have seronegative, symptom-negative lupus. What's with all these lupus patients? I'm pretty sure I know enough about the disease. I mean, it's such a detriment to my learning.
So what I'm hearing is I have lupus,
Yes.
Uh-huh. What does that mean?
Well, nothing, really. I don't know how we're going to treat it. Or you could choose one of these treatments here. Shared decision making. You can just pick one out and give it to me. All right. Steroids.
So I needed to drive all the way up here to be told I needed steroids? Could have just gotten them from my dealer.
No? All right. Let's pick again. Steroids. I think I should treat her with steroids.
So what I'm hearing is steroids.
Solumedrol? Yeah, solumedrol. No?
Okay.
Okay. How about another one? Ooh, Decadron.
What's up? Oh, hey, Kelly. What's up? You're here kind of late. Yeah, day admitting, unfortunately.
Oh, you're day admitting. Oh
Yeah.
my.
Yeah.
Well, you don't have too much longer to go, so it's okay.
Yeah.
Why are you here so late? I just got off cardiology clinic. We have this really cool case, so I stuck around. But we're done. We go home, go do some fun stuff, maybe go for a hike. I'm so glad I'm on cardiology clinic and not day admitting. Right now, I think I'm gonna go home, and I'm not really sure what I'm gonna do, but it doesn't really matter because I'm going home and I'm done for the day.
I mean, I know the quarterback today, so hopefully they'll spare me, but who is this quarterback?
Dr. Mehdi, Mr. Quarterback.
It's just this mythical person, they sit behind a desk.
All right, I will send someone shortly.
They just page QB 24383 and expect us to page them back with whatever admission they send us.
So when we were residents, we used to take care of 50 patients. We used to sleep in house. That's why they called us house staff, because this is where we used to live. So when I'm assigning patients on the floor, you know, the residents, they're slackers. They're probably playing somewhere now. And 4 admissions a day, that's ridiculous. We used to do 10 admissions a day and go home smiling at the end of the day.
But you're almost done. You only have like 10 more minutes, right?
They have to work. That's what they're supposed to do.
Yeah, hopefully, probably get that 555 admission.
Oh, wait a minute. There's no way that this is going to be an admission. You're fine.
Whew. Okay, it's not.
Okay, good. See?
All right.
Everybody always...
Yes.
Not yet.
Everybody always says that you're going to get an admission, like 555. It never happens.
I don't want to jinx myself, but I think I'm ready to go home. I'm gonna head to sign out, find my intern.
An outside hospital transfer coming from, you know, I think they've been at Hopkins and Baylor before. They've been hospitalized for, I don't know, 60, 70 days or so, but they should have all the records with them. I don't actually know why they're coming, because I didn't pick up the call for this one. But yeah, good luck.
I knew my rent was gonna be late about a week ago. I worked my ass off, but I still can't pay it though. But I got just enough to get off in this club. Have me a good time before my time is up. Hey, let's get it now.
Ooh, I want the time of my life.
bartender, line up some shots, cause I'ma get loose tonight. She's on fire, she's so hot, I'm no liar, she burned up the spot. Look like Mariah, I take another shot. Hold her, drop it like it's hot. Dirty talk, dirty dance, she a freaky girl, and I'm a freaky man. She on the rebound, broke up with her ex, and I'm like Rodman, ready on deck. I told her wanna ride out, and she said,
Is this the diet of a cardiologist?
Oh yes, it's heart healthy.
Oh, good.
Does that look gross? No.
But I still can't pay it though. But I got just enough to get off in this club. Have me a good time before my time is up. Hey, let's get it now. Every night, like my last. Mom, you know the drill. Shake that. Go ahead, baby, let me see what you got. You know you got the biggest booty in this spot.
Hey man, can I ask you some questions?
No. You know me, I'm off in the cut. Always like a squirrel, looking for a nut. This is up for show, I'm not talking about luck. I'm not talking about love, I'm talking about lust. Now let's get loose, have some fun. Forget about bills in the first of the month. It's my night, your night, our night. Let's turn it up. I knew my rent was gonna be late about a week ago. I work my ass off, but I still can't pay it though. But I got just enough to get off in this club. Have me a good time before my time.
What's a mini CEX?
I don't know.
I owe it to Dr. Ramsey's hard work, pushing me through every step to get all the 60 mini CXs done.
Yes, that's amazing. What
I think so too.
Throw it up tonight. So they say the only reason you shouldn't do a rectal exam is if you don't have a finger.
So you might as well roll it up, blow it up, drink it up, throw it up tonight. This for everybody going through tough times. Believe me, been there, done that. But every day above ground is a great day. Remember that.
Took you home and be a woman. Show me how you do. I wanna shut down the club with you. Hey, I heard you like the wild ones, wild ones, wild ones.
Oh, I like crazy, foolish, stupid. Probably going wild, fist pumping music. I might lose it. Glass to the roof, how we lose it, lose it, lose it. I don't care tonight, she don't care, we like almost there, the right vibe, ready to get live, ain't no surprise, take me so high, jumping those dives, surfing the crowd, ooh, said I gotta be the man, I'm the head of my band, mic check 1, 2, shut them down in the club where the Playboy does, till they all get loose, loose, out the bottle, we all get fit in again tomorrow, gotta break rules cause that's the motto, club shut down 100 supermodels.
Hey, I heard you were a wild one. If I took you home and be a home run, show me how you do. I wanna shut down the club with you. Hey, I heard you like the wild ones, wild ones, wild ones.
How do you feel about the CICU?
Should I give the political answer, politically correct answer, or no?
Whatever answer you want.
Somehow, some runway, gotta raise the roof. All black shades when the sun come through. It's on like everything goes. Wild out, baby, to the freak it shows. What happens to that body is a private show. Stays right here, private show. I like a mundane, don't talk at high pain. Tolerance bottoms up when it's champagne. My life, come Muhammad, then we hit Spain. Too easy with you there, we get insane.
Hey, I heard you were a wild one. Ooh, if I took you home and be a home run, show me how you do.
Is this a sterile procedure?
I don't think so.
Yeah, I don't think so too. Where do I put it?
Oh man, I'm pretty sure last time they let me watch this, they stuck it in that one there that's sort of pulsating.
Oh yeah, no, you're right. I am gonna go for it. Is this thing in the audience yet?
Let's begin. I am who I want to aim now. Running with wolves and I'm on the prowl.
Show you another side of me, a side you never thought you would see. Tear up that body, dominate you till you have enough.
I hear you like the wild star.
Just be yourself. And congrats for your graduation.
No, for the rest of your life, have fun. Enjoy what you are doing. And whatever profession you choose, hospitalist, primary care, or subspecialty, have fun.
Just wishing you remember to love what you do.
Hey, I heard you like the wild ones, wild ones, wild ones. I am the wild one, break me in, saddle me up and let's begin. I am the wild one, tame me now, running with wolves and I'm on the prowl.